On a single day last week, Wednesday, 5 people died from suspected overdoses in Milwaukee and Racine counties, 3 of them before noon. The terrible toll of heroin and opioid deaths just keeps rising. The Milwaukee County Medical Examiner reports 349 overdose deaths so far this year. That's 6 more than all of last year. The office projects it will have investigated 420 overdose deaths by the end of 2017, and there have been roughly 3,000 overdoses where people didn't die. What more can we do to stop this epidemic? We're asking Milwaukee Alderman Michael Murphy, who created the Milwaukee City-County Heroin, Opioid, and Cocaine Task Force. Alderman, it's good to have you back on the program.
Thanks for having me.
How would you describe what we're seeing in this community at this moment in time?
I would say it's one of the worst public health epidemics facing not just our community, but our country. When you think more people are dying this year alone than all have died in the Vietnam War, in 1 year, nearly 57,000 people will have died of opiate and heroin addiction. It is a public health threat that we've not seen in many years.
And why can't we seem to get a handle on it? We talk about it, we have prevention programs, it's very much in the public spotlight, and yet the problem continues.
You know, it's a terrible addiction, and a lot of it was created by illegal narcotic. People got hooked on oxycodone, we went after the pill doctors, but people are still addicted, and they have now moved on to heroin. And what you're seeing now on the streets, unfortunately, is a new drug, fentanyl or carfentanil, which is 5,000 times more stronger than morphine or heroin. And that's why you're seeing a huge number of people dying this year, and unfortunately it looks like next year.
This also, I would assume, probably relates to crime in this community.
Well, that's a key issue. You know, when you look at all the mobile drug pharmacies, a little boy, Bill Thau, lost his life because drug dealers fighting about territory shot the wrong house up. It's permeating all different areas of our culture and all social demographics.
So let's talk about what can be done. And again, we are doing things, and there is a lot of public discussion, but what else could we be doing or should we be doing?
Well, I think still the stigma associated with this drug, any drugs, is resultant in people stepping back and thinking people can pull themselves up by their own bootstraps. This should be looked as a brain disease and treated as such. And certain things we are trying to do better. One is prevention, doing better education, trying to reach out to young people, but also looking at the drug courts, looking at working in partnerships with others, having take-back initiatives to try and keep drugs out of the stream, interdiction and going after the people who are bringing up the drugs, and certainly treatment. All those things need money, and I think there is some money now that's being made available from the state and the federal, but keep in mind the stigma associated with this drug has really resulted in people stepping back and not doing as much as they should have. If I had told you this was Zika, this would be a totally different conversation. There would be billions of dollars being made available. But because it's drugs, people have not been there.
So you're saying that there is this perhaps a public perception that it's a sign of the user's weakness, it's a sign that the user has the problem, it's not a public health epidemic, it's something you could stop yourself if you chose to.
I think that's the case, and I think we're starting to see a change in that. And I would like to point this out. I think one of the big differences we're looking at this versus the crack epidemic in the 80s where we arrested everybody, and that was people of color, mainly African Americans or Hispanics. Now it's affected the white community, and there's been a change in attitude. That's the only silver lining in this whole debate. But that's a good thing that people are recognizing this should be looked at as a disease of the brain. And these are not statistics. I mean, people look at this and they think it's some war in some other country. These are people that we know, family members, their brothers, sisters, or uncles, children. And I think I want to communicate to people that we have to have more compassion and realize this is a terrible addiction and we need to reach out to people to provide them resources, provide them opportunities for treatment, and work with them to try and get them healthy.
Alderman Michael Murphy, who's been working on this issue for some time. Alderman, it's good to have you back on the program. We appreciate your time today.
Appreciate it.
Coming up next, the latest on the GOP tax reform plan, why some students could see their tax bills skyrocket.